it's tough. I mean, we have to be honest about it. Labor can be the most challenging activity that any woman does. It doesn't always start off that way, and we never know when it's going to end. And it's moment to moment. And that moment to moment is what drove Birthing Better fathers and mothers to develop extensive skills. We wanted to be able to have skills that would work for any situation that we found ourselves in, and that meant moment to moment. It didn't mean whether care provider was doing an internal on us. It was if the care provider was doing an internal on us and we didn't like it and we had to lie on our back and it was more painful, then we were dealing with all those things. And all those things had to do with our ability to relax. Now, I do have to tell you something that I've learned because I'm a body worker. So I come from an osteopathic background rather than a chiropractic background, and I work with fascia, soft tissue. And what I learned very early on in the early 1970s, and because I've worked extensively in multiple traditional communities as well, is that every language has a word for relax, and every language has a word for soften. And in fact, the fascia, the connective tissue, does not respond well to the word relax. When a woman in labor is tense, it is very hard for her to relax. And when we say relax, it's sort of a general term. So we told this story as we developed these skills because it was a good example. You have a woman who's really, labor's intense. She's facing the wall. She has her hands up on the wall like that. She's up on her tippy toes. Her partner's coming up to her and her shoulders are up near her ears, and the midwife is coming up to her, and they're both sort of thinking, gosh, if she could only relax. So they say to her, relax, to which she goes, you try, I'm trying, stop it, be quiet. And that's about it. So if the partner or the care provider goes, just relax your shoulders. This is what we learned. Babies aren't coming out your shoulders. Get off of your tippy toes. Babies aren't coming out your tippy toes. And we don't have a good explanation for how people should relax in their pelvis. And that's why we develop skills. One of the skills is called the pelvic clock. The other is directed breathing. The other is the touch relaxation. We have a lot of skills, but we have to learn them from about 24 weeks of pregnancy onwards so that we can incorporate them into our body. We don't have to practice them constantly. If you can take a breath in now and expand inside your pelvis as you breathe in, you never have to practice that again. If you can exhale that breath and go around inside the pelvic girdle and soften inside your right hip and your sacrum and your left hip and your lower belly and pubic bone, you don't have to practice it. You now know it, but you didn't know it 2 minutes ago. So when we're talking about relaxation, we were talking about doing it inside. Now the reality was the next video is going to be about tension. So we discovered that there are 4 types of tension, and you're going to have to hold on and wait until I do that video. So we had to know how to work with 4 types of tension. And the reality is everything we have to soften is inside us. Some of what we do at birth, but the other part of it is the internal work. And starting at 32 weeks for 5 minutes a day to prepare the inside of the birth canal. Perineal massage is only working with the outlet. That's not where mostly the tension exists. The tension exists is tighten up your bum. Tighten it. Okay, tighten up your rectum. Pull it up. Tighten up behind your rectum. Draw your sit bones closer together. That is the deep inside tension of the birth canal that we have to work with, because it's something the size of a grapefruit is coming down into the top of the birth canal and puts pressure on the rectum, and we feel how big it is, we tense up. And if then we are put into a semi-recumbent position, which blocks the sacrum and stops the baby from pushing the sacrum out and back so it can turn the corner to come towards the vaginal opening, all of these things have to do with tension and have to do with relaxation or softening or opening up the space. So when you're thinking about relaxation, ignore every part of the body. So I'll explain to you why. Put your shoulders up to your ears. Just do that. You can stay soft inside. It's not a problem. Tense up inside and keep your shoulders relaxed. Nobody can see that tension. So you have to soften and let go. It's not relaxing inside. It's softening, and it's softening individual places. Softening each side of your tailbone, lower part of your sacrum. Softening behind your rectum. Softening on each muscle on each side of the rectum to your sit bone. Soften around the bladder. So these are why we developed all these skills. We had to learn to be precise. And for women, we had to learn to apply these skills. And we applied them at every moment of the birth. Not every single skill all at once, but there was this consciousness when we are skilled. It's an embodiment of the skills inside our body. So at the beginning of this video, I asked you to breathe in and expand inside your pelvis. I told you you never had to practice it again. You don't. Just remember to do it. Remember to think about the distance between your sit bones and just let your sit bones be soft in between rather than to just slightly create tension there. When you think about your tailbone, the lower part of your sacrum now, can it be mobile? Can you tuck your tail? Can you flex your tail backward? And if not, you need to soften in those muscles and learn how to do that. So relaxation is this vast thing. Can we soften inside the brainstem? Of course we can, but it's mostly the direction down there. And some of it is through movement, like the body skills. If you do a hip lift on somebody and then take your hands off and say to them, just slight tension inside, you can't move the hip. So we do it very practically. For instance, when you're sitting there, if you put your hand on your head and you just refuse to let your hand turn your head, you can push very, very hard and your head won't turn. It is connective tissue. We can make our connective tissue, our fascia, rigid. And when I push just ever so lightly, I can turn my head because I have no tension in the fascia or connective tissue, even though I might have my shoulders up like this. So you have to understand that the fascia is very important to the birth situation and knowing how to soften it. And giving birth to a baby, having a cesarean, whether planned or unplanned, can also require you to know how to relax. Not because you may feel as tense as you do if you're having labor contractions, but it takes time. It's exciting, it's trepidatious, it's an unknown, you're about to have a baby. All of those things can require you to use more relaxation skills. And that's why it's important to become skilled prior to your birth and then make a commitment that no matter how your birth unfolds, that you will use skills to work through the activity of birthing your baby. Why? Because the third global childbirth goal is recovery of the mother and the baby in the short, medium, and long term. And the one thing that we know is that birth memories last a lifetime. And when you have given birth without skills, you feel much more disoriented the rest of your life. When you give birth using skills, you feel increasingly more connected. You are much more creative as a parent.